Ever wondered what thyroid cancer really is and how it develops? Let's embark on a journey to demystify this prevalent condition. Thyroid cancer is a malignant tumor that originates from two types of cells within the thyroid gland, the thyrocytes or the parafollicular cells. This type of cancer is particularly common in women, particularly those between 30 and 50 years of age. But what makes someone more susceptible to thyroid cancer? The main risk factors include a history of childhood irradiation to the head and neck and a family history of thyroid cancer. Typically, thyroid cancer presents as a firm to hard thyroid nodule or nodules. The first step in evaluating a patient suspected of having thyroid cancer involves a TSH assay and a thyroid ultrasound. Certain sonographic signs, such as a solid hypoechoic nodule with irregular margins, microcalcifications, and evidence of local infiltration into adjacent structures or cervical lymph nodes, can hint at the presence of thyroid cancer. Upon identifying these signs, doctors often order thyroid scintigraphy, especially in patients with low serum TSH. In this test, a malignant nodule typically appears as cold or hypofunctional. However, to confirm the diagnosis, a cytopathological analysis with fine needle aspiration biopsy is required. Thyroid cancer can be categorized into 4 types based on the cell of origin: papillary, follicular, medullary, and anaplastic thyroid cancer. The lion's share of thyroid cancers undergoes surgical treatment, which typically involves a total thyroidectomy and, in some cases, a hemithyroidectomy. Once the surgery is complete, patients often receive adjuvant therapy. This can include radioactive iodine ablation and TSH suppression therapy with L-thyroxine, radiation therapy, and chemotherapy. However, in the case of advanced anaplastic carcinoma, only palliative care may be feasible. It is important to remember that the prognosis depends on the type of thyroid cancer. To summarize, thyroid cancer is a malignant tumor that predominantly affects women between the ages of 30 and 50. It typically presents as a firm to hard nodule in the thyroid gland and is diagnosed through a series of tests, including a TSH assay, thyroid ultrasound, and fine needle aspiration biopsy. Treatment usually involves surgery followed by adjuvant therapy, and the prognosis depends on the type of thyroid cancer. So next time you hear about thyroid cancer, remember it's not just one condition, but a complex disease with various types and treatment options.